Hello and Assalamu alaikum. Ultrascan diagnostics. This is the CBCT of the patient that you had requested. The area of interest is the lower right third molar and the lower left third molar. On the panoramic view, you can see that the lower right third molar apex is primarily close to the inferior alveolar nerve canal, whereas the lower left third molar apex seems to be relatively far away. We're going to show you on the transaxial view, which is the proximal view. This is the lower right 8 on the proximal view. We're going to zoom in for our kind doctor. So this is where the inferior alveolar nerve is, with approximately 4.7 millimeters away from the inferior alveolar nerve at the apex, and you can see that the nerve is buccal and the wisdom tooth on the lower right hand side is much more lingually placed. We've got a good guttering area as well, and this tooth should have no effect during the extraction on the lower right inferior alveolar nerve. We've got good cortical support on either side. The apex is relatively close to the lingual cortical plate, so this is something to be kept in mind during extraction. This is the lower left wisdom tooth now. So this is the lower left wisdom tooth. As you can clearly see, the lower left wisdom tooth is also relatively far away from the inferior alveolar nerve. We're approximately 7 millimeters away. The inferior alveolar nerve is inferiorly and buccally as compared to the lower left, my apologies, wisdom tooth. As we are moving distally, you can see that this is the distal root of the lower left wisdom tooth, and you can again clearly see that it is relatively far away from the inferior alveolar nerve. Now we're going to show you the axial view. The axial view is basically the top to bottom view. This is the right hand side. This is the apex of the wisdom tooth on the right hand side, right here. And this is the inferior alveolar nerve. This is the apex of the wisdom tooth on the left hand side, and this is the inferior alveolar nerve. As you can clearly see, we've marked for you that the inferior alveolar nerve is quite significantly far away from the apex and the wisdom tooth on either side. Something to be of noteworthy is the lingual mandibular tori that we see here. They don't seem to be infective or any problematic, but it is something to be noted. Thank you very much.